For this Thursday, March 31st, we are very pleased to have on the Zoom connection today as we get everything in order here. We welcome Sara Donkersloot. Good morning, Sara.
Good morning, Gary, and welcome for those of you who are listening to Wellspring. It's a weekly radio show sponsored by Spectrum Health, the Zeeland Community Hospital. Midwives focus not only on maternity care, but also on the full range of women's health needs throughout life. And I'm delighted this morning to have with me Katie Steele. She's a board-certified nurse midwife who recently joined the Spectrum Health Medical Group, but she's been a part of the Zeeland Community Hospital team for, well, she'll tell you about that, for many years. Good morning, Katie.
Good morning.
So Katie, tell us, what is a midwife?
So there's a couple kinds of midwives, but I'm a certified nurse midwife, which is an independent healthcare provider. CNMs are highly qualified providers with graduate degrees in advanced practice nursing. I'm licensed by the state of Michigan, and I have a certification through the American Midwifery Certification Board. CNMs work with lots of members in the healthcare team, such as the physicians and the nurses, to provide the highest quality of care. We can work in a variety of settings, the hospital, medical offices, clinics, and birth centers, providing lots of different services too. And we are covered by most insurances.
So Katie, I mentioned earlier that you've been a part of Zeeland Community Hospital for, well, I don't know, you can maybe tell us how many years. So tell us a little bit about your journey. Maybe first of all, where did you graduate, what you chose as your major, and how you decided to become a midwife.
Sure. I have been a nurse for almost 20 years. I graduated from Hope College with my undergrad degree in nursing. And I've worked at Zeeland Hospital for all of those years, and specialized in labor and delivery nursing for the last 15 years. I loved caring for patients there and their families during their birth experiences. And over those 15 years, I just really fell in love with labor and delivery and creating a bond with families during this pivotal moment in their life. And I really wanted to continue doing patient care.
Sorry, I'm interrupting you. So,
Yeah.
What was involved in becoming a midwife? You needed to go back to school, get your degree.
Yeah.
Did you have to have experience? Tell us a little bit about that.
Yeah, so someone suggested to me to look into becoming a midwife. It wasn't really my idea to begin with. So I started looking into it, and yeah, you have to go back to school. I went back and got a master's degree from a graduate program. I graduated from Frontier Nursing University, which is based out of Kentucky, but they have just a really, really strong program for midwives. That's kind of their specialty. So, yeah, continued that schooling, similar to the track of like a nurse practitioner, where you're getting that advanced practice degree, and had some clinical experiences, being the provider role, not just the labor and delivery nurse role, which is so important and great experience. I'm so thankful I had that experience being a labor and delivery nurse, and not just picking this specialty without that background, because it has really been helpful in me feeling comfortable in my role in a fairly short amount of time.
So Katie, you know what I mean? I guess the question would be, is many people, when they think about a midwife, they think, oh, they deliver babies. Is that the only thing that you do?
Absolutely not. So my schooling, and as I start my practice now, is focused on all of women's health care. So of course, everyone thinks midwife is all about maternity care and delivering babies, but we can do a whole range of healthcare needs. I can do annual gynecological exams, family planning, STI testing, caring for teenagers' concerns, all the way through menopause.
So just for people, you reference STI. Just tell everyone what that is.
That's testing for sexually transmitted infections.
My guest today is Katie Steele, and she is a board certified nurse midwife who recently joined the Spectrum Health Medical Group. But as she has shared, she had 20 years working at Spectrum Health Zeeland Community Hospital as a labor and delivery nurse. She is joining me via Zoom connection. If you have a question, you can call Gary at 395-1450. That's 395-1450. And he will pass the question on to Katie. So, Katie, you said that you just started. Tell us a little bit. Where are you seeing patients?
I'm seeing patients at the Spectrum Health Medical Group OBGYN office in Zeeland.
And that is connected to the hospital. So it makes it very convenient for people to come and see you. So, let's talk about labor and delivery. And you've had the experience of being a labor and delivery nurse. If something would happen during labor, will there be a physician or another provider available to assist?
Absolutely. I work closely with all the physicians, and I have the fortunate position of knowing them really well because I've worked with them for so many years, just now in a little bit different capacity. But we're constantly collaborating. We want to ensure a smooth and safe delivery. The ultimate goal, the highest mission, is for a safe mom and baby. So they're close and available in the event of a complication. But I'm absolutely able to help guide patients through their medical decision making and involving that doctor when needed. I am also trained to assist with C-sections. So in the event that an emergency C-section was needed, I would be able to continue care all the way through the operating room because I would be there to assist the doctor.
So, when someone, finds out they're going to have a baby, they have all the appointments, with their doctor, at certain times. I can remember, in my pregnancy, I went once a month, and then later on you see, 2 times a month and then weekly. Is that what happens with you? If someone says, I want to have a midwife, are they going to be seeing you the same way they would see if they had a physician?
Yes. Yep. Similar. The prenatal care really could look very similar to many people. It's just the difference of the focus in the office visit, the time spent. But yeah, that course of prenatal care would be very similar.
You mentioned the focus in the office and the type of care. Talk a little bit about that. Is that something that you would be offering?
Yeah. So as a midwife, I really specialize in low risk birth and focusing on physiological things, what our body is meant to do. That pregnancy and labor and birth is something your body's made to do. It's not a medical illness to be managed, but I'm there to help guide. As a nurse, I really enjoyed teaching. Sara knows I used to teach classes at Zeeland Hospital. So I think that patients will feel.
I hope we didn't lose Katie on the connection there, Sara.
Yeah. Well, I can
Hold
always.
on. Yeah, we'll keep it. We'll keep it on there as well.
We'll keep it on there.
Yeah.
So we're talking today with Katie Steele, and she recently joined the Spectrum Health Medical Group as a board certified nurse midwife. And we are really excited about that because Katie brings over 20 years of experience in her position.
Yeah, we got Katie back. Katie, thank you for trying to reconnect us. Sometimes it goes.
Yeah.
So Katie,
go ahead, Sara.
I'm ask you another question. We hear the word midlife and then we hear doulas. Are they the same thing?
That's such a common question. And no, it's not the same thing. Doulas are someone who's hired by a mom who's pregnant. They're such an important member of the healthcare team of a woman's birth team, but their role's different. They're there as a trained professional to support the mom and her husband. They know a lot about birth and labor, so they come with an expertise, but they're really there to be a support person. While the midwife is the medical professional who's doing all your prenatal care, helping with shared decision making for medical decisions, and the one actually helping to deliver the baby.
So, Katie, are you able to prescribe medications? And, if someone needs a test to order that test for a pregnant mom?
Yeah. Yep, I can do all those things. Similar to seeing a nurse practitioner in the office, I'm able to do those.
So, Katie, this is really exciting for Zealand because, there had been studies, that people wanted a midwife option available for women in our region. You are the first to provide services at the Spectrum Health Medical Group in Holland and Zealand offices. Is there a plan to hopefully expand if there's a need?
Yeah, there is a plan to expand. We hope that this service continues to grow in interest. Spectrum Health is using lots of midwives throughout their system, and it's really exciting to see it coming to Zealand Hospital. So as the demand grows, and we fill up my schedule, I really hope to gain partners and really grow this midwife part of the practice.
Okay, so Katie, what would it like? We have 2 minutes left. What would it like if someone says, okay, I want Katie to be my midwife? What's going to happen when they come into your office?
Again, it looks kind of similar to seeing other providers, but I hope you really feel a difference in the amount of time we spend talking about your questions, really explaining recommendations and why we recommend those things, and really feeling like when you leave an appointment, we're sharing in decisions. And every woman's birth experience, health journey is different. And I really want each woman to feel like they're an important part in their own healthcare journey.
And Katie, we are out of time. Just really appreciate you just blazing the trail and being that first midwife at Zealand and offering also for people in the Zealand Holland area. Katie is at the Spectrum Health Medical Group OBGYN office in Zealand, which is located right on the campus of Zealand Community Hospital, connected. If you would like to make an appointment with her, you can call 494-5850. That's 494-5850. Until next week, Spectrum Health Zealand Community Hospital wishes you well.